Imagine standing at the top of a flight of stairs. You have places to go and people to see, but instead of walking down, you freeze. Your knee is acting up again. You are in good company. In the US alone, more than 30 million adults live with this type of joint pain. It is a common part of aging, especially for women or those of us carrying extra body weight. The signs usually follow a specific pattern. You might feel a deep, dull ache after a busy afternoon, or wake up to joints that feel stiff and slightly swollen. Sometimes the knee might even feel like it is going to suddenly buckle right out from under you. And then there are the stairs. Walking down a hill or a flight of steps puts a concentrated type of pressure on the joint, which is why going down often causes a sharper pain than walking up. When our knee hurts like that, it is natural to picture it like a rusty mechanical hinge that is slowly grinding away. That mental image leads to a logical conclusion. To protect the joint, you need to sit down, rest, and stop moving. But sitting perfectly still often makes the problem worse. Our bodies do not work like car parts. Avoiding movement out of fear tricks the joint into shutting down the very systems it needs to stay healthy. To understand why, we have to look at how the knee is actually built. It is a living system that relies on physical motion to function. This diagram illustrates the inside of a human knee. When you move, the physical act of bending your knee acts like a pump. It pushes a natural lubricant across the cartilage, keeping it nourished and protected. The large muscles in your thigh serve as the body's primary shock absorbers. Every time you take a step, they catch the weight and soften the blow before it ever reaches the bone and cartilage. When we stay seated for days on end to avoid pain, those thigh muscles shrink. Without that strength to absorb the shock, the delicate joint space takes the full, heavy force of your body with every single step. Rebuilding that strength does not mean you have to start running marathons. Your joints thrive on consistent, low-stress activities like a gentle walk, riding a stationary bike, or a daily swim. A physical therapist can help you find the right balance. They work with you to design a specific routine that builds up those protective muscles without pushing you into a pain flare. Movement works because building stronger muscles shifts the physical weight of gravity away from the sensitive bone. One of the most direct ways to protect your joints is to reduce the total amount of weight they have to carry. This illustration shows how gravity multiplies weight. Because of how we walk, losing 5 to 10% of your total body weight results in a significant reduction of the physical force striking your knee during every step. It also helps the joint from the inside out. Excess body fat naturally releases chemicals that increase swelling and inflammation throughout the whole body, including directly inside your knees. You can also give your joints external support. Simple tools like soft knee sleeves or specialized braces wrap firmly around the joint, providing stability and the confidence to walk again. A walking stick or cane is a helpful tool for balance, but surprisingly, most people hold it on the wrong side of their body, which limits how well it can actually protect the joint. This diagram shows the right way to do it. You always want to hold the cane in the hand opposite to your painful knee. When you step down on the sore leg, you press the cane down at the exact same time. This shifts your center of gravity safely away from the affected joint. Carrying a little less weight and using the correct supports changes the physical math of walking. A trip to the store goes from feeling like an exhausting hurdle back to a normal, accessible task. Getting moving is difficult if the joint is actively throbbing. That is where targeted help comes in, like pain-relieving creams you rub directly on the skin or standard anti-inflammatory pills. During periods of intense pain, your doctor might suggest a localized steroid shot directly into the joint to quiet things down for a few weeks. These pills, creams, and injections are tools for managing symptoms. They do not have the power to regrow lost cartilage. Long-term reliance on strong prescription painkillers like opioids also carries significant side effects without improving how well your joint functions over the long term. Instead, think of pain relief as a stepping stone. These treatments exist to dial the pain down just enough so you can perform your strengthening exercises comfortably. When people hear the word osteoarthritis, they often assume they are destined for joint replacement surgery. While surgery is a reliable option for late-stage cases, it is not an inevitable fate for everyone diagnosed with the condition. Managing your knee is about preserving the ability to walk the dog, play with grandkids, and stay active in your neighborhood. You can start building toward that goal today. Take a slow, gentle walk to the end of your street, or make a quick phone call to set up a consultation with a physical therapist. The knee is built to adapt and get stronger when it has the right support. With proactive management and the right tools, growing older can still mean enjoying the activities and the people that you love.